So initially I was in graphic arts and printing technology, and people had kind of convinced me to go this direction, and so I had some school in before, but my first degree is a bachelor's degree, which is a 4-year degree. Most people take 5 years just because some of the science classes can be tough, and so that way they're not just swamped every single semester. So in order to be a flight nurse, you actually just have to have an associate's degree in nursing, but most hospitals don't want to hire you unless you have a bachelor's degree, or at least that you commit to getting a bachelor's degree. I actually have a master's degree, but that's not required.
Okay.
But you have to be a registered nurse or have your RN, so and a degree in nursing before you start. But there are lots of programs to go associates to bachelor's, so transition programs. And most hospitals have tuition assistance. So if you're hired as a nurse or even as a nursing assistant, they'll give you so much money a year to kind of help you complete it, which is really nice. Yeah. For my undergrad, I went to Lewis Clark State College in Lewiston, and then I did get a master's degree, which isn't required to be an entry-level nurse, and that's from Idaho State University. I started out in the critical care unit at St. Luke's downtown, and I was there for over 3 years, and then I applied to be a flight nurse, which is really awesome. And it's funny, I kind of knew a little bit about flight nursing before I went into it, but I wasn't sure exactly what we could do and how deep it would go. And so I work with a paramedic, so we have a pilot, a paramedic, and a nurse in the helicopter or the airplane. And we will do about 50% pre-hospital calls, so we could go land out on the highway if somebody needs help, or the mountains, or just a really rural area where there's no healthcare access. And then about half the time we're going from hospital to hospital. So usually smaller hospitals that have a really, really sick patient and they need help, we'll take them to bigger hospitals. And sometimes we take them from our big hospitals around here all the way out to hospitals in California, Oregon, Utah. I've been to Nebraska, Colorado, just kind of, it depends on where the specialty is that they need. So. I was hired with nurses from several different colleges around the area, and I really felt like Lewis Clark State College had a fantastic nursing program, and we had a high success on the NCLEX on the NCLEX test, a high success passing, which you don't always find. And I found in compared to the other new grads, I felt more prepared where they were struggling in certain areas. So. I think in the beginning, the most rewarding part was getting out on time, right? Just knowing that I was getting paid to do what I wanted, and I was becoming proficient at it. And then I think it kind of bridged to the most rewarding part was doing something incredible that really helped somebody. So, kind of being a detective and finding something that somebody else hadn't found out and helping, direct a patient's care. And the longer that I'm a nurse, I think the most rewarding things are just helping somebody in the worst moment of their life. So it's not necessarily the sickest of the sick anymore, even though I do take care of those. It's more about, I guess, being able to touch a human soul, really, and they're scared and afraid, and making them feel like I'm competent, but also finding a way to calm them and kind of be the rock that they need in those moments that I have them. And so honestly, I think that's more than anything right now, is just being able to touch a life no matter how I do it. So if you're in the hospital, typically it's a 7 a.m. start or 7 p.m. And so it's a 12-hour shift. So 7 a.m. to 7 or 7:30 p.m. or the reverse, 7 p.m. to 7 or 7:30 a.m. And you are running a lot. You are on your feet a lot, especially in the critical care units. There's some other units maybe you don't run quite as much, but being a nurse in the hospital is hard work. It's really rewarding work, but it's hard work. And so for a hospital nurse, you'll go in and you'll get reports. So you'll kind of get a pass down from the other nurses you're taking over from. And you go in and you assess them, you listen to their lungs and look at their abdomen, read about their history, why they're in the hospital, kind of talk to them, get their meds ready for the day. In the critical care units, all the physicians and social workers and dietitians, respiratory therapists, and the nurses, we all round on every patient and kind of talk about their progress and what we need to do for them. And then throughout the day, it's Maybe they need an IV, maybe they need some medications, maybe they need to go to surgery, maybe they need to go get one of their coronary arteries fixed because they're having a heart attack. You basically just support them throughout the day. And I think the nice thing about being a nurse is people look at doctors and think they do all the cool stuff, right? But your doctor on average is with your patient for 5 to 10 minutes, right? And your nurse is with them for 12 hours. And so a lot of the tough stuff, a lot of the catching people who are getting sicker, that's all nurses. Like, we're there 100% of the time making sure that they're okay. So a lot of the cool things you see people do on TV, nurses do. And so I think the general public doesn't realize that. As a flight nurse, I work 24-hour shifts and 12-hour shifts. So I stay at the airport, and it's kind of like people think of like a firefighter, how they live in a house and they're there waiting for a call. So as a flight nurse, that's what I do. We're in a kind of a house at the airport waiting for a call. And so I come in at 9 a.m. and if I'm on a 24-hour shift, that means I leave at 9 a.m. the next morning. And we have pass down we have to get. We have chores that we have to do. We have to check out our medical packs because everything that we need to use to take care of a patient we carry with us. And so we check out our vehicles. So if I'm on the helicopter that day, we make sure all the helicopter equipment is good because it's like a mobile ICU or intensive care unit. Same thing with the airplane. Station chores, like I said, we review each other's charts, kind of look at the medical care, make recommendations to our medical directors, or hey, look at this, or hey, what do you think about this? And then we kind of wait. And so sometimes if I'm on the airplane, we also go in the ambulances. We can go to the hospitals and kind of check on people or kind of check things out, see what's going on. But as a helicopter crew, we're kind of hanging out for the day. Sometimes we cook together, which is cool. We have beds to sleep in at night, but we have a radio on us all the time. So if the tones go off, then we have less than 10 minutes to take off. And it's usually more like 7 or 8 minutes. And it could be that we're going to a hospital. It could be that we're going to go be in the mountains. It could be that there's a big crash on the highway. You never know, which is really cool about my job. As far as a nursing job goes, I don't think, if you like excitement, there's not a cooler job in the world. So I've had to stay overnight in the mountains before. Trying to think of some of the really cool situations. We've had to call the National Guard to hoist a patient out. So they bring in a helicopter that drops a line and picks them up and kind of lifts them out that way. We don't do that. So we have to be able to load them into our helicopter. But yeah, I mean, we could be helping out an ER that's overwhelmed and kind of turning things around where they didn't have enough resources and they didn't have enough hands and expertise to kind of fix a patient. So we get there and we kind of get them going the right direction. I can put breathing tubes in. I can actually perform surgery, which is cutting the side of your chest open to reinflate your lung. I can cut your neck open if you have some type of injury where you can't place a breathing tube. I actually cut your neck open right here and put a tube in. I can drill into your bone. If I can't get an IV, then we input fluid and medications into the bone marrow. We can give blood. We can do all kinds of stuff, really cool stuff. And typical nurses in the hospital wouldn't get to do that. It's all extra training. So that's a couple years ago, there was an airplane crash in the Owyhee Mountains, and our Boise helicopter, along with our Twin Falls helicopter and one of Life Flight's helicopters, had to circle and actually find these people. So when your airplane crashes, you have an emergency locator device that beeps. And so we kind of just circled, listening for the beeping. Life Flight actually had to go back. And then we went back to get fuel, and our Twin Falls crew found them. There were 3 patients, and they were all alive, which is crazy. So we had to hike in a mile or 2, build a fire, kind of keep them warm, assess them, and you don't have all of the bells and whistles you have in a hospital. And even in the helicopter, you can't carry all that stuff when you're hiking in a mountain. And so we did have to start IVs, and we determined because of their injuries that we weren't gonna be able to carry 3 people to the helicopters or hike them out. So we had to call the National Guard to come in and drop a hoist, and that was probably a 12-hour production. And so we're in the snow and building fires, and yeah, it was incredible. There was actually a book called Rescued that the man, his name is Brian Brown, and I can say that because he published the book, but the man who was the father that was in the accident, and he was on Good Morning America, and so it's kind of a big deal. So if you're kind of wondering what that call's like, you can go get that book. But Gosh, well, the first piece of advice, also because I have college age kids now and it's kind of something they've gone through, is do your homework. Prepare yourself so that you're not struggling and you're not playing catch up. I think that would be number one. Just take it seriously. If you can take college credits while you're in high school, do that, because that'll put you so far ahead. But I think the second piece of advice is, even if you've kind of messed up, if your GPA is not great, you don't give up. I actually had my son when I was 17, and so I ended up dropping out of high school and getting a GED, and it was difficult for sure, but now I have a master's degree, right? And I'm doing the most awesome job in the world. And so I think no matter where you are coming from or what position you're in right now, it's never too late to kind of turn it around and really focus on what you want to do and make up lost time. So just be diligent. Nobody's going to do it for you, so it's a lot of hard work. But you can do it if you really put your mind to it. I believe that. So that you're not going to go have fun every weekend, but it's going to be rewarding when you get over it. And I tell my kids, it's 4 years of tough stuff, right? But after that, you've got your whole life. And the other thing is people change careers 2 or 3 times. So, if you get into something and you're like, well, I don't know what to pick because it's going to be forever. No, get into something, do it, and give it 5 or 10 years. And you know what? If you don't like it, you can go do something else. So don't stress so much. I think that's the thing. Lighten up.
Yeah.